inserted, and that's it. So this is an instruction on how to use Dr.NIC's bipolar electrosurgical coagulator, which has two working ports, the first and the second. In other words, one instrument is connected here, and the second instrument is connected to this port. As you can see, there are 4 operating modes here, and you can switch between them using the touchscreen. If we select the sealing mode, the optimal setting is approximately 60, 70, 75. You can adjust it slightly higher or lower and see how it works with the tissue, but this is a universal mode. It allows you both to cut and to seal depending on how you move the instrument. If you move the forceps like this, you will be cutting. If you clamp the tissue and wait, you can seal a vessel or tubular tissue. The tissue is essentially thermally sealed through protein denaturation. If we are talking about cutting, the power should be set much higher, approximately 90 plus or minus 10 points, because there will be a much stronger energy effect between the jaws. When dealing with large tissue masses, this allows you to dissect more quickly while simultaneously achieving reliable hemostasis. Then we have coagulation. This is the lowest power mode, approximately 45 to 50, and sometimes 40 is sufficient. You turn the jaws over in this manner and apply them to the tissue. The important thing is to maintain a space between the jaws, and then you coagulate the area where necessary. The automatic mode is used when you need to seal a specific structure. You can partially compare it to how a LigaSure device works. For example, this is an automatic sealing mode. You clamp the vessel and wait approximately 1.5 seconds for the sealing cycle to complete. Sometimes it takes a little more or less, around 1.3 seconds, for example. In this mode, you do not need to set the power manually. By the way, you can also adjust the volume of the sound signal. The device will beep, for example, during automatic sealing. When the sound stops, the automatic sealing cycle is complete and you can release the instrument. Then the second mode / second port works in exactly the same way. You connect the instruments here. There's also a feature called ABCD. These are presets for different surgeons. Essentially, surgeon A, surgeon B, surgeon C, and surgeon D. The same principle applies here as well. Next, regarding the foot pedal, mode 1 switches the mode with your foot. You can switch the setting here as well. Output 1 activates the first port, and output 2 activates the second port. So I'll start with the second port, the second pedal, which corresponds to this side. Basically, at the very beginning of the procedure, you connect the instrument, select the appropriate mode, for example, welding, set the power here, and that's it. This is the instrument you will use most frequently. I would call this the stationary port, while this one is the interchangeable port. The reason is that you connect one instrument here, but during the procedure, you may use 2 or 3 different modes simultaneously, and you can easily switch between them with your foot. So without having to touch the main unit, you simply switch modes with the pedal, switch again, and so on. You need to get a little accustomed to the pedal itself, but after a few procedures, it becomes quite intuitive and everything will be fine. Basically, that's everything here. Regarding instrument sterilization, everything is done except for the autoclave. The unit is switched off using this button, and there is basically nothing else you need to do. As for the operating modes, I've explained everything. Overall, it is quite simple and straightforward. Regarding the instruments, we have bipolar forceps. For cutting, you make movements like this. For coagulation, you turn the forceps over, open them slightly, and then coagulate the tissue. For sealing, you clamp the tissue, wait until the automatic cycle is completed.